this video, we will discuss the approach to study anatomy. I'm going to share tips on how to, first of all, prepare for the class. Second of all, ensure that you are maximizing the amount of material you're going to understand and learn while in class. This will require students to pay attention during the lecture. And third, ensuring that you're getting adequate practice after class to make sure that you understand the high yield objectives. As it pertains to preparation, I will divide it into two categories. It all depends. Are you more of a visual learner or do you enjoy reading? For visual learners, I would suggest watching a YouTube video before going to class, relevant for that day's material. For people who enjoy reading, I would suggest you reading the textbook, the relevant pages that are going to be talking about that class material. For those that are more visual learners, I would suggest you watching the Noted Anatomist. These are going to give you some short videos, less than 15 minutes, that are going to give you just a big overview of what to expect for that day's lesson. This MedTutors YouTube channel will also be posting anatomy video questions to allow you to practice and apply your knowledge. For those that enjoy reading, you can take a look at the textbook Essentials in Clinical Anatomy. That's going to give you a good foundation of the material that will be covered. The last thing I would suggest you to do before going to class would be to spend about 10 minutes looking at the learning objectives for that specific lecture, just to ensure that you have a rough idea of the material and what they want you to understand as you go through the lecture. Ultimately, the preparation time for a lecture should take 30 minutes of time. You want to take about 30 minutes of time to prepare for the lecture. This will give you the ability to set a foundation of what you're meant to gain from the lecture, and it will put you in a good position as you go and sit for the lecture. Pay attention during lecture time. As you sit in for the lecture, be it virtual or in person, I would suggest you have a learning objectives sheet on the side. As the lecturer is going through the material, I would suggest you follow along and you tick the learning objectives as you go on through the lecture. Once you reach the end point of the lecture, I would suggest you once again take a look at the learning objectives, and you want to highlight the learning objectives that one, you understood. And two, you also want to highlight the learning objectives which you feel like you need to go over in more detail. By doing this, you have immediately taken note of the areas you need to address before moving on. Therefore, you're ensuring that you understand the key learning objectives of that lecture to ensure that you're able to maximize and peak your knowledge for that specific lecture on that day. Since you're watching this video, I'm very sure that you are a hardworking medical student. So I'm going to put double tick on this learning objective. We have discussed the importance of preparation, the importance of paying attention during lecture time. Now there's one more P we need to discuss. Practice. It's very important to have enough practice, especially in a class like anatomy. I will discuss the key resources you want to use as you practice to ensure that you are able to apply your knowledge. The first resource I would suggest for practice would be the University of Michigan Medical School Foundational Anatomy Practice Questions. The link is in the descriptions. This question bank allows the students to practice the foundational knowledge they have learned from class. Some of these questions may be one-liners, however, they're going to focus on the specific important objectives you want to learn from class. Once practicing these questions, you're able to identify the key areas that you may want to go back and take a look at within lecture. I advise you to use these questions first in terms of practice because they allow you to highlight the key areas that you need to work on before you go on to practice on more difficult question banks. Let's imagine you have covered the back and the spinal cord. All you have to do is click the back and spinal cord, and the next thing you will do is pick self-assessments, and that will take you to the questions. You would like to utilize these questions after you finish a specific lecture or that's going to be focusing on that specific area. Once you've completed the questions for that specific topic from University of Michigan Medical School Foundational Anatomy Practice Questions, you want to go on to do more challenging questions. And I would say the next book you can use for questions be the Gray's Anatomy Review, 2nd edition. Those are going to have more clinically related questions. They will be more challenging, and these will be more of second to third order questions. It's important to start off doing the recommended questions for that specific topic area and lecture, and then ensuring that you're able to allow yourself to have as much clinical practice related to the material. As it pertains to the lab component, with some element of it being virtual, you want to still give your opportunity to watch virtual dissections to allow you just to visualize how these structures are going to be found in the body. So I would suggest using the dissection videos that are made available to you to ensure that you can watch the specific dissection that's pertaining to the specific topic area you have learned for that day. Another useful tool that can be used would be Complete Anatomy, brought to you by 3D Medical. This is going to be an app that can be used from iPad, tablet, or on your phone. This is going to be a useful resource that can be used to further solidify your knowledge and allowing you to have more additional practice to identify where some structures are found. Once again, remember the 3 P's we've discussed: preparation, paying attention during lecture, and practice. Feel free to like and subscribe to the MedTutors YouTube channel if you would like more content related to anatomy and other basic science subjects. Here is a list of all the resources that were used in this video. If you have any questions or concerns, or would like a more detailed explanation about how to study for anatomy and how to ensure you have a head start, don't hesitate to contact MedTutors.